Thank you for joining me today. In this video, we are going to go over medication psychopharmacology. Psychopharmacology principles include the goals of the treatment is to achieve a symptom remission, improve functional recovery, minimize side effects, enhance medication adhesiveness, prevent relapse, and improve quality of life. General prescribing principles include establish an acute diagnosis. You want to establish an acute diagnosis. You want to rule out medical causes of death and substantive conditions. You want to rule that out before you prescribe psychopharmacology. Use evidence-based practice based on the first line of treatment. Start with lowest effective dose and titrate gradually. You want to monitor therapeutic response and side effects of the medication. Consider the age, comorbidity, pregnancy, renal function, liver function, potential drug-to-drug interaction. Incorporate with the psychopharmacology with the psychotherapy and psychosocial interventions, whatever indicated. So pharmacokinetic, it's absorption, and absorption is the root of the absorption. Factors influencing the absorption include the route of the medication administration, food interaction, GI, pH, and GI mortality. Common route, as we know, is the oral, sublingual, IM, IV, transdermal, nasal, long-term, long-acting injection. Distribution affected by the protein binding of the medication, because the medication have the receptor site that they can bind it to. So protein binding affected the distribution of the medication. Body fat composition affected the medication. Blood-brain barrier penetration can affect the medication distribution. Volume of the distribution and blood volume can affect the distribution. Metabolism of the medication is affected by the enzymes. Most the psychiatric medication undergo hepatic metabolism through the psychochroma P450 enzyme system. That is the major enzyme system. For example, fluoxetine and paroxetine inhibit the enzyme CYP2D6. Smoking induces, there is an inducer and inhibitors. Some medication are inducers, some medication are inhibitors. So, for example, smoking induces the CYP1A2 that lowers the concentration of the clonazepine and olanzapine. So inducers lower the concentration, inhibitors increase the concentration. Fluvoxamine inhibit enzyme CYP1A2 and can increase the clonazepine concentration. So if the medication is inhibitor, it increases the concentration of the medication that they are inhibiting. Inducers, they lower the concentration of some of the medications. Elimination is primarily happens through the either liver or the kidney. If the patient has a liver damage or kidney damage, dose adjustment is required and may be necessary in a renal or hepatic impairment. Major neurotransmitters that affect the drug effectiveness, pharmacodynamic. Pharmacodynamic is affected by the neurotransmitters: serotonin, dopamine, norepinephrine, GABA, glutamate, histamine, acetylcholine, antipsychiatric medications like selective serotonin reuptake inhibitor. That means it increases something. So it increases the serotonin. It inhibits the serotonin reuptake. It inhibits serotonin reuptake, and that increases the serotonin. Examples of that SSRIs include Zoloft, fluoxetine, paroxetine, escitalopram, lexapro. Major mechanism of SSRIs that they inhibit serotonin reuptake and that increases serotonin in the synaptic area. Common indication for SSRIs include major depression disorder, general anxiety disorder, panic disorder, social anxiety disorder, OCD disorder, PTSD disorder. Common side effects of SSRIs include GI upset, sexual dysfunction, insomnia, headache, increased anxiety and depression, low sodium, so you want to assess that, especially older adults. SNRI, serotonin and norepinephrine reuptake inhibitor. So this medication, they increase both serotonin and norepinephrine. An example of SNRIs or serotonin norepinephrine reuptake inhibitor are venlafaxine, duloxetine, desvenlafaxine. And mechanism of SNRIs is that they increase both serotonin and norepinephrine neurotransmitters. And they are useful for depression, anxiety, neuropathic pain, and fibromyalgia, restless leg syndromes. However, the side effects of this medication include hypertension, it increases the blood pressure, GI upsets such as nausea, insomnia, also sweat, atypical antidepressant medications include bupropion. Bupropion advantages include it has a minimum of sexual dysfunction. It don't increase the weight like the other antipsychiatric medication, and it can be used the smoking cessation. However, you want to avoid a person with a seizure disorder because it can lower the seizure threshold, and person with eating disorders. Mirtazapine, it is a typical antipsychiatric medication, and advantage of that is it improves the appetite. Most people that I seen being prescribed to are older adults who are having a low appetite, failure to drive, having a low weight. So it increases the appetite. Mirtazapine increases the appetite, improves sleep, usually in underweight patients, as we talked about. Advantage of the mirtazapine is sedation and weight gain. Trazodone is useful for insomnia, and advantage the side effects include low blood pressure, it lowers low blood pressure, and priapism, which is rare. Typical tricycline antidepressant medications example include amitriptyline, nortriptyline, imberimine, clomiprim, and imiprim. Mechanism of tricycline antidepressant medications is that they block serotonin and norepinephrine reuptakes. Major side effects of this medication include sedation, weight gain, cardiac condition abnormalities, overdose toxicity, and anticholinergic effects. Monoamine days inhibitors. Examples include the Nerdal and Barnate. And they are indicated for treatment-resistant depression and atypical depression. Improvement consideration is that the important considerations are that you have to monitor diet, because thiamine diet can increase the risk of hypertension crisis. So they have a thiamine diet restriction, washout period before switching to serotonic medication, and risk of hypertension crisis. So there has to be 14 days between the serotonic medication, other medication, and then 14 days you will stop the MOA inhibitor and wait 14 days to be clear from the body. Mood stabilizer medications include lithium. Lithium mechanism is a mirroring multiple inner cellular signal pathways, and it's indicated bipolar 1 mania, acute mania, and maintenance therapy, and suicidal ideation prevention. Therapeutic level of the therapeutic concept. Lithium has a limited or short therapeutic index, and if the person have a mania, the therapeutic index or the level of lithium concentration has to be 0.8 to 1.2. Maintenance can be lower, and it can be between 0.6 to 1 for maintenance therapy. You want to monitor the blood lithium level, renal function, thyroid function, calcium concentration, calcium level. Signs of lithium toxicity include tremors, confusion, seizure, ataxia. Fulbrate is indicated for acute mania, mixed episode, and maintenance therapy. You want to monitor liver function, platelet count, and drug interaction. Side effects include weight gain, tremors, liver toxicity, pancreatic inflammation, and thyrogenicity. So this one is indicated for pregnant mother. Lamotrigine is the best for bipolar disorder with depression and maintenance therapy. It requires a gradual titration to reduce the risk of the Stevens-Johnson syndrome, which is the rash in the skin. Carbamazepine is you want to monitor for the complete blood count, liver function, sodium level. Potential side effects of carbamazepine include agonolocitosis, which you want to monitor the absolute neurophilic count. Also, you want to monitor sodium level. You want to monitor liver toxicity. Antipsychiatric medication is first generation of the antipsychiatric medications. Example include Haldol, chlorpromazine, fluoxetine. Risk factors of this first generation antipsychiatric medication include EBS symptoms, extrapyramidal symptoms, this hyperprolactemia, and teardrop dyskinesia. So abnormal muscle movement is hyperprolactation risks. Second generation antipsychiatric medications, example will be epomeprazole, Risperdal, olanzapine, Seroquel, Latuda, clozapine. Common side effects include weight gain, metabolic syndrome, sedation, low blood pressure or orthostatic blood pressure. Special consideration of this second generation antipsychiatric medication include clozapine requires absolute neurophilic count monitoring. Olanzapine has among the highest metabolic risks. Epomeprazole has the lowest risk of hyperprolactemia. Anxiety medication, benzodiazepine is the short-term use, and the mechanism of benzodiazepine include enhanced GABA-A receptor activity. Clinically is used for short acute anxiety. It's used short term, and it's used acute anxiety disorder, panic disorder, because you want to control that symptom, alcohol withdrawal, catatonia. However, the risk factors include dependency, withdrawal risks, tolerance, cognitive impairment, especially for falls for the older adult. It increases the risk of falls for older adult, cognitive impairments, respiratory depression, and they also have withdrawal symptoms if you want to stop them. Their withdrawal symptoms mimic like the alcohol withdrawal symptoms. Buspirone or Buspar is indicated for general anxiety disorder. Advantage of Buspar is it don't have the dependency. The person don't develop dependency and has a minimum sedation, so patient can work, can go to school. Limitation of Buspar is it has a delay onset that approximately takes 2 weeks to 4 weeks to be effective. Other anxiety medication include for short-term anxiety usage is hydroxyzine or Visceral. It's used for short-term anxiety relief and insomnia. Stimulant medication is is used for ADHD and narcoleptics. Examples include amphetamine and methylphenidate, less dextroamphetamine. The common side effects of these medications include appetite suppression, insomnia, increased blood pressure, heart rate, and is contraindicated for uncontrolled hypertension. If the patient have uncontrolled hypertension, is contraindicated for taking stimulant medications. Somatic cardiovascular disease is also contraindicated. Active psychosis is contraindicated for stimulant medications. ADHD, non-stimulant medications for ADHD. Examples include antidepressant medications, guanfacine extended release, clonidine extended release. Is usually used when the stimulants are ineffective or contraindicated, as we mentioned before. Medication monitoring, you want to monitor the weight, you want to monitor the body mass index, waist circumference. You want to monitor the fasting blood glucose for the especially as second generation anti-psychiatric medications and lipid profiles, because they increase the appetite, that increase the weight, that increase the lipid, that increase the blood sugar, and that increase the metabolic risk. Movement disorders, you want to monitor that, and you want to use a standard assessment tools such as the Samson Angeles scale, Brandis akathisia rating scale, Ames scale. Antidepressant medication, you want to assess the mood improvement, medication compliant, emergency for suicidal ideation. You want to also monitor a serotonin syndrome. You want to monitor mania or hypermania. Drug interaction, you want to monitor serotonin syndrome, as we talked about. Symptoms include agitation, hyperflaxity, cluness, tremor, diarrhea, high temperature. You want to manage by discontinue the medication and supportive care, and in moderate to severe care. You want to also monitor the neuroleptic malignancy syndrome. Symptoms of the neuroleptic malignancy syndrome include fever, rigidity, change in mental status, elevated creatine kinase, aromatic instability, and the treatment is to discontinue the medication, antipsychiatric medication that is causing this. And supportive care, consider a dantrolene and bromocriptine if the symptoms are severe. Special population consideration, for older adults, you want to start slow at the lowest dose, and then you want to increase slower and minimize the anticholinergic burden and avoid long-term benzodiazepine usage. For pregnancy mothers, you want to be careful and you want to weigh the benefit of the mother with the risk of the fetus. You want to coordinate care with specialist provider. You want to avoid tetracycline when possible, particularly fulbrate. Fulbrate is contraindicated for pregnant women. For children and teenagers, you want to monitor the growth, especially if they are taking stimulant therapy. You want to monitor behavior activation and suicidal ideation. For education, you want to educate the patient regarding of the expected onset of the treatment and the medication. You want to educate them to take their medication on time and the way being prescribed. You want to assess the common side effects of the medications they are taking, and you want to educate them to report to you if they develop that side effects. And also you want to educate them the serious side effects and require immediate evaluation so they can call and come for evaluation. You want to educate them to avoid alcohol and illicit substance usage. You want to also educate them importance of the scheduled lab monitoring for the levels you want to monitor, and safety medication storage, so if they live with anybody, that person cannot use their medication. And some medications may keep in fridges, some medication may locked in box depending on the instruction. Always assess bipolar disorder before initiating an antipsychiatric therapy. Start slow and increase slow, particularly older adults. Clozapine remains the treatment of choice for treatment-resistant schizophrenia. Lithium has the strongest evidence for reducing suicidal ideation in a bipolar disorder patient. You want to monitor a metabolic syndrome routinely, patient who is taking second-generation antipsychiatric medications. Evaluate drug-to-drug interaction through the cytochrome P450 enzyme before prescribing. You want to know if other medication is inducing the medication or inhibiting the medication that you are prescribing. You want to also combine psychopharmacology with the psychotherapy to be effective, and also you want to combine psychosocial interventions wherever possible. Thank you for joining me today. Please prescribe and join me again. Thank you.